I believe, unlike many dentists, that gum disease can be cured. I mean, I go
Mm.
on record to say that. I'm not here to prove anything to anyone. I'm here to help people with the knowledge I gained.
Basically, everything I know about dentistry, you turned it upside down on its head.
My passion is helping people avoid dental treatments, which is what I feel dentistry should be about. And what I see as the most tragic thing of all is that people don't know enough about what is happening in their mouths. They don't have this full picture. And it comes down in the end to empowerment. In Denmark, the average person has a quarter of a cavity per person for life. I mean,
That's
for
right.
life. Thank you for being, it's, I would say, courageous to be out there, and,
Well,
and
yeah.
open the door.
Well, hello, Dr. Ellie. Super nice to finally see you here.
This is great. I mean, this is what everyone was asking for, right? So here
Exactly,
we are.
exactly. All right. Well, I just wanted to give a quick recap for anyone who's watching. So I discovered you and your content some time ago, and so I tried your system once, and it didn't work for me. So I made a video on that on my channel, and then that's kind of how we got connected through that first video. And I discovered that I did it wrong. So we ended up talking and I redid your system and got better results. And that just kind of led into a deep dive conversation about basically everything I know about dentistry to be true. Just kind of you turned it upside down on its head. And so I just want to unpack hopefully most of these questions that I have just for myself and for our viewers to kind of join in on the conversation. So if you don't mind, I would love to just, yeah, dive straight into these questions.
Well, I think
So
it's really important that, you know, we explain differences to people. And I think this is just a wonderful way of doing it. I've never had that opportunity before with a dentist in somewhat in opposition who feels strongly, to defend their situation and yet have a conversation. And I think that's wonderful. So I want to
yeah.
thank you for being, it's not
Oh,
about, I'm not here to prove anything to anyone. I'm here to help people with the knowledge I gained. I mean, I've been
exactly.
doing this for 50 years. And, I think I've been told I mean, my passion isn't filling teeth. My passion is helping people avoid dental treatments, which is what I feel dentistry should be about. So maybe
Absolutely.
I'm a hygienist in disguise. I don't know.
I love
It's certainly been my passion. So I'm thrilled to be here, and thank you for being, I would say, courageous to be out there, and
well, yeah.
open the door. So I appreciate that. Thank you.
Yeah, I'm all about, seeking truth. It's not I'm totally not by the book, this is what they taught us, so this must be true. I know that I'm not a conspiracy theorist, but I know that, things people have their agendas, and so I'm
Sure,
always out there to seek what's true and kind of
sure.
sift through all the noise. So, anyway, yeah. So my first question to you, actually, so your complete mouth care system, it involves several different products in a very specific order, and somehow these products in this very specific order just the only way I could say is like magically solve dental problems, for in my perspective. And so I'm just curious, like, how did you discover and come up with these steps with these specific products?
Sure. Well, it's an interesting concept today because what I look at today is people who think what they want to put in a product based on, they like the idea of clove or they like the idea of iodine or whatever it might be, and they compose products around it with absolutely no clue what the long-term effect of these things going to be.
Mhm.
And I didn't do that at all. I just knew when I had a problem, and the problem was actually my mother. The
Mm,
problem was that my mother was 45. I was
mm,
at dental school, and my mother had been told to have all her teeth taken out and have dentures.
yeah,
At the dental school where I was studying in London, in Guy's Hospital, they knew that they had done a study in a convent and shown that the earlier these women, there was women, had lost their teeth, it appeared the more risk they were at for early onset dementia.
Right.
And early onset dementia had plagued all the women in my family, my aunts and my great aunts and
Mm,
and they all had dentures. So I told my mother, "You mustn't have your teeth taken out. We have to find a solution." So that
yeah,
was my crisis. And
yeah.
I knew taking her to the dental school was not going to be the answer because in the 1960s, there were no hygienists in the UK at that time. That
Mhm,
wasn't there were not in so dentists were being taught at dental school how to deal with periodontal disease or the hygiene side of dentistry. And all we did were gingivectomies, where you basically drew a line and cut the gums to that level to reduce the pocketing. You
that's
literally
crazy.
cut away the pockets. And these people ended up with these, I mean, long in the tooth, I think was the phrase
Yeah,
that,
yeah.
sort of described these poor, unfortunate people. And I knew that it didn't stop the disease because once the gums had healed, the next amount of pocketing began because nobody was addressing the balance of bacteria, the disease in the mouth. So I knew my mother should not come to the dental school. I had to help her. Now, I want to take out of that story because that was my crisis.
Right.
What had happened to me
I
as a
love
kid?
it. I think
And
you're
you like this story.
I'm
And you see,
excited about this part.
it kind of ties into dentistry because in order to be a dentist back in the day in the 50s and 60s in England, women were not welcome.
Mm,
We had to have certain grades of physics, chemistry, biology, and Latin. And in
mhm,
order to get those grades, you had to really go to a private boarding school.
mm,
And my parents, they sacrificed to send me there where I would study physics, chemistry, biology, and Latin from the age of 13
mhm.
to get the highest possible grades. And we used to study 6 days a week, and it was a very Spartan. I don't know if you ever read Jane Eyre, but that very tough environment, very military.
That's crazy
Um,
how things have changed and the things that women had to do just to get the same education.
and guys got into medical school if they played rugby football. They didn't matter what their grades were. I mean, it was
Oh,
really, you have no idea. So here I was, I had to get the top levels, I had to study in this very Spartan environment. And one of the things that occurred was I had acne.
mm,
And everyone with acne was told they had dirty skin. And they used to put us in front of a 3 compartment stainless steel sink. I can still see it today. And they'd bring a big bag of brushes and
mhm,
ivory soap, and we'd line up and scrub our faces because they were dirty. And I would scrub and scrub. And that was it. When you washed the ivory soap off, that was the end of the story. And of course, that didn't solve my acne. My acne got worse. It was itchy. It was uncomfortable. I was trying. And it was so uncomfortable and so demoralizing because I felt dirty. I felt like there was something wrong with me.
yeah.
And and one day I was walking through a department store in London and the beginning of the Clinique cosmetic
Yes. The
counter.
clean
And this lady called out, "Honey, would you like me to assess your skin?" And I'm thinking, "Oh, who wants to look at my horrible acne?" And she was like, "You need this very gentle, you have very sensitive skin. You need this gentle cleaning liquid. You need this toner, and you need this really, moisturizing uh, on the top." And I went away, and I would say it took a week, maybe 10 days, and
mhm,
everything had cleared up.
hmm,
And after this agony and the demoralizing ongoing drama,
yeah,
all of a sudden everything is fixed.
that's
And
crazy.
knowing that, I decided I would try and find the same kind of products to fix my mother's situation.
Hmm,
And back then, the first mouth rinse that I recommend is one that was used as a pre-treatment rinse in dental offices. That's what it
mhm,
was developed for. So I thought, well, that's a good kind of cleanser.
okay,
And then there really weren't many choices back then. That's another thing you have to consider. I don't think it could have been done today, but
yeah,
back then the only toothpaste proven to repair and remineralize teeth was the original Crest. It had
mhm,
had randomized clinical trials, so that was my pick.
yeah,
Um, I had learned that you needed to massage gums with a dense kind of toothbrush, so we used that. Listerine was like a toner. I didn't know much about it, but it was had a long history of use. And I knew that if you had this acidic Listerine followed by the fluoride, a dilute sodium fluoride, that it would enhance the mineralization of the fluoride. It's part of that idea in pediatric dentistry. Back in the day, we used to use these acidified fluoride gels.
Mhm.
They were way stronger, but one of the points of acidifying the mouth is to make the remineralization more intense, I guess you would call it. It would be a better mineralization. So that's how I began, just kind of with this idea of recreating what Clinique had created that had helped my skin. And the interesting thing, if we fast forward to a couple of years ago, I was at a microbiome conference
Mhm.
and I sat next to one of the world's top skin. He works for a big skincare company,
Mhm.
and he and his friends wanted to go out for dinner. I wanted to go to bed, so I said, "I'm sorry, but here's my book." And I had just written "Mouth Care Comes Clean," which
Mm.
explains the microbiome and how my system works with it. Well, he called me the next day and was like, "I can't believe how similar mouth biology is to skin biology."
And then
I
at the
think
same time, it's like, how can we not believe? It's like the same body, right? What would you
well, and once you start, I mean, I hear a lot of dentists talk or people talk about how the mouth is the beginning of the digestive tract. But that's really a misunderstanding because although some digestion goes on in the mouth, the bacteria of the mouth are not similar to the digestive bacteria. Digestive bacteria are a lot more interchangeable and affected, and you can actually change the gut bacteria in a couple of weeks with a change of diet. They've proven
Mhm.
that in, tribal sort of cultures where they eat very different things. People have taken fecal samples and seen the change in 2 weeks, and then when they go back to a Western diet, doesn't take long to change back. In the
Right.
mouth, we know that in the biofilm that's over our mouth, 40% of it actually is found to have developed in childhood. It's
Mm.
incredibly stable. Kinda like the skin biome that you don't even see on your skin, it
Right.
doesn't change that much. It's pretty hard to damage it, and it's pretty hard to improve it. It has its own kind of balancing act that it does, and I think the mouth is very similar.
Yeah, that's very interesting. So then with this, correct me if I'm wrong, but with your complete mouth care system, I think one of the biggest things that you kind of discuss is you can reverse gum recession and reverse cavities. Am I understanding that
Well,
correct?
gum disease, and people have a lot of trouble with the difference between gum disease and gum recession, and I think it's one of the misnomers used in dentistry along with biofilm,
Mhm.
because again, most hygienists talk to their patients about stripping the teeth of biofilm.
Yeah.
I would say that since 2007, 2015 for sure, we have a better understanding that our mouths are not sterile.
Hmm.
You don't want no biofilm. What you
Right.
want in the mouth is a healthy, protective biofilm covering of everything.
Yeah.
When you strip away that biofilm, you get erosion of teeth, you get, uh, sensitivity, you get, exposure where teeth can wear away.
Yeah.
So I think that's the first thing I want to say. Healthy biofilm exists in my book. And
Hmm.
it's, and we can test. You can test my mouth, and I have a wide diversity of healthy bacteria. You don't want pocketing, and in
Right.
those pockets you get gum disease.
Hmm.
And I believe, unlike many dentists, that gum disease can be cured. I go
Mm.
on record to say that, whereas most dentists will say you cannot cure gum disease. You can only
Manage it.
sort of maintain a stable state by having ongoing dental cleanings.
Hmm.
And I would say that they are wrong because they are not seeing biofilm as a film that can be modulated. You don't want to strip it away because
Hmm.
that's not how you would improve skin. Nobody stripped my skin of all of its biofilm.
Yeah.
I
No,
use
support it.
products
Support it with. Hmm.
gradually modulated my skin. And in the sake in the case of my acne, it only because probably I was a very healthy person otherwise, So it didn't take long. It just took the right pH and the right amount of protection
Yeah.
and cleaning in a very gentle way instead of that scrubby, severe way, and that's what I would say to people when they come to me often. They've been, I mean, I hate to say yelled at because hygienists get mad, but there are hygienists out there who are really quite, um,
Aggressive with their, "You
they're
can't do this,
they're
that."
they're trying to motivate their
Me,
patients.
by the way, I would never. I'm so
It's
kind.
unfortunate. It's sort of this is why I have such empathy for people who've been told to floss more, and they say they are flossing, but they're not being believed because the outcome hasn't shown that.
Yeah,
And
I've
I think
definitely
it
guilty of that for sure, is telling people, like, "You should floss," but then they're, they say, "I am flossing." I'm like, "I can tell you're lying because I see bleeding and plaque everywhere," but then and now I'm starting to see, cases where I truly see and believe that the patient is doing absolutely everything, and actually recently I was talking to a patient, literally doing everything under the sun, and still struggling with periodontal disease and just kind of being one step behind the whole issue, right? So,
and
yeah,
it's so
very
unfortunate because then you alienate this person, then this person goes through ongoing treatments and expenses. And what I see as the most tragic thing of all is that people don't know enough about what is happening in their mouths. They don't have this full picture.
yeah,
And when they get to retirement, the financial plan is saying we got to save up for all your dental expenses. And people are like, well, what do you mean? And then all of a sudden, that's when this recurring process of filling teeth, refilling because of secondary decay. Well,
yeah,
secondary decay is the infection in your mouth that never was
taking
ended, was never treated, was never controlled. It's like a forest fire that is just kind of, maybe your hygienist is able to keep it under control as a sort of gentle ember. But when you reach 70 years old and your immune system perhaps starts to get weaker, all
yeah,
of a sudden you're bone loss, you have periodontal disease, you have fillings falling out, your enamel is breaking. This is tragic.
yeah,
And
I
this
think
is
oh, go ahead, sorry.
no, I'm just saying this is why I try to teach. I always try to teach till the end of time because
Yeah,
it's
and
so
I think
important.
that's the biggest issue, even having this interview, right? The biggest issue I feel like is the disconnect, first of all, between like, first of all, systemic whole body health and then the mouth. It's just somehow so separated, so segregated. It's like you go to the dentist to treat all these cavities, you go to the doctor to treat cancer, and it's like these people are not communicating. There's so much things at play together, and people don't realize it. The patient doesn't realize it, and they're the one that gets the short end of the stick, right? So,
Exactly. And the trouble is, I mean, I actually was a founder of AOSH, the American Academy for Oral Systemic Health,
mm,
because I knew about my mother. Now, my mother's end of the story, by the way, which your listeners, followers need to hear, was that we stopped. I mean, she was told she had to have all her teeth taken out. I'm
yeah,
still looking for photographs of her because I'm sure her teeth were all over the place.
mm,
And she didn't end up having her teeth all taken out. She actually ended up with minimal dental work, saving those teeth. And, she kept them. The bone regrew. I mean, they say it can't happen. It happened because she died at age 95, which would have been 50 years later, with minimal dental treatment
yeah.
and her teeth and no dementia. I mean, she got a little nutty at the very end, but I think it was mainly because she came to stay with me and she didn't want to do that. But, um, I cleaned her teeth every night. Even I'd go into assisted living at the end, and on her in hospice at the very end of her life, I still use xylitol, on a swab to swab her mouth. And,
Yeah,
this is so kind to people. This is something anyone can do. And you
yeah,
don't, she didn't want to go to the dentist at 95 years old. She wanted to be the most comfortable she could be. And
yeah,
we can do that for our
yeah,
loved ones with this system. So there may be other ways of doing things, but I have found, I I mean, I had this confidence in my system, and I've always felt that I needed to share it. That's really why I do what I do. That
That's
is, my reason for being at the moment is to share in books and, with talking with people like you,
yeah,
how to do this and why it shouldn't be a threat.
yeah.
So let's go to the other questions about it. I mean,
Well,
I
you
love
kind of
answering questions. I think I
yeah.
ramble less with questions.
Yeah, no, well, you brought up an interesting point where you said there I don't know how I don't remember exactly, but you literally just said that there are other ways to go about it potentially, and that was actually one of my kind of grievances with your system at first because as you know, when the first time I did it, I tried it for 2 weeks, checked with floss, and I got bleeding gums, which I never had bleeding gums. I was just in shock, and I pretty much like tossed your system out the window. I was like, "This doesn't work. Don't listen to Dr. Ellie." And I was thinking to myself, like, I'm 32 years old, and I've been able to keep my teeth in good condition using other methods. So for me, it was like you know, there are different ways to approach it, but ultimately the big picture, right, is focusing on the microbiome, the oral microbiome. It's not just about brushing and flossing, especially for folks who struggle with the traditional, recommendations and it's not working for them. So
Well, and I would like to ask a question. What does bleeding gums mean? I mean, how would they train a hygienist to know what does a bleeding gum tell you? Would be
that
good.
there's inflammation and something foreign going on under the gums that is causing them to bleed when you touch them. Sort of
How
not
do
much.
for example, if you cut your knee, all
Right.
right, suppose you graze your knee quite badly,
Mhm.
and then it's healing, and it after 2 weeks, you've got granulation tissue, right? You haven't got the skin over the top yet.
Mhm.
If you got a length of string and you rubbed it over your knee at that healing point before the final skin covering has covered it,
Mm.
what might happen? You might get bleeding, right?
Right, right. I see what you're
And
saying.
it doesn't mean that I mean, part of healing is inflammation. I mean,
Right.
healing is
Inflammation is
inflammation,
yeah.
actually. I mean, it's you don't want chronic inflammation.
Right.
And chronic inflammation, you're absolutely correct, is something stuck under the gum, likely some hardened calculus. It's causing this chronic inflammation that's creating a ripple effect that is causing inflammation. You can even read in the body inflammation as a rise in A1C and CRP levels. And I mean, you can actually measure it.
Yeah.
Yeah, I agree with you that if you have plaque induced bleeding gums or chronic periodontal disease with plaque and inflammation, bleeding is a bad sign. But if
Yeah.
you have healing happening,
Yeah.
and if your knee was healing, how long would you give it to grow skin back?
Couple weeks.
You know?
Depends on how big the wound is, right?
Exactly. And you mentioned to me afterwards when you and I were talking that you had been pregnant. I don't know
Mm.
whether it was during that time or after. But that whole couple of years around pregnancy, your body responds to inflammation and is bizarre, right? All of us. I mean, I include myself on that. I mean, estrogen increases your inflammatory response. That's
Right.
how it allows growth and baby growth, and it changes how our body that's why we are more at risk for some things to happen during pregnancy. So, I don't know if that had I mean, definitely gum health
I
changes
guess
during
I just
pregnancy.
I guess I just saw like I'm a linear thinker in that in terms of like, all right, well, I've always had healthy teeth. I've always brushed and flossed. I've never experienced bleeding. I did your system. I started feeling bleeding. Like, where is this bleeding coming from? It must be because I stopped flossing. So
Yeah.
for me, even the fact that as you explain, like when there's bleeding potentially because of healing, I guess my question then is like, what was healing if at least what I thought to be, my mouth was in good shape beforehand. So that was
Yeah.
kind of
I mean, I would argue that every day of our lives our teeth demineralize when we eat and drink,
Right.
and every time we eat and drink, and that they then repair themselves in the 2-hour period or so after eating and drinking.
Mm,
Damage occurs when we violate that balance.
mhm,
And we violate it either by having an infected mouth that is pumping out acids all day long, or by constantly eating and drinking. So
un
we never give our saliva the time to be undiluted. I mean, thick, regular saliva, not watered down, because the minute you water down saliva, you change its composition. And the greatest thing about saliva is that it is usually super saturated. That means
Mhm,
it's dripping with the minerals that your teeth need. So
mm,
all we have to do is eat and drink. It's so simple. And then have a 2-hour period where we allow our mouths to recover. And
mhm.
then maybe we eat and drink again. And we do this sort of periodic eating and drinking with plenty of recovery period.
Yeah,
Xylitol actually enhances that by pulling saliva into your mouth, making it even more mineralized because stimulated saliva is uber mineralized because it's like the fire department. It thinks it's coming to an emergency. So
yeah,
it's coming in with all its minerals. And it's also full of immunoglobulins to fix your gums. So if somebody's saying, oh, she's just selling something, I'm selling your own saliva as the best
yeah.
possible thing we have to repair our teeth and gums.
You
And
mentioned, you mentioned xylitol. I actually wanted to ask you about that. Before that, just a quick question about my first attempt, with the healthcare system before we move on from that. I got a lot of I got a really hard time from people in the comments on that first video about me using the wrong ACT mouthwash. There's a
Mhm.
slight difference in the fluoride concentration, and so I
Mhm.
just wanted to confirm
Sure,
with you, double check,
sure.
was it
Is it,
big of a deal that I used the wrong ACT
well,
mouthwash?
it's kind of go back to the let's go back to the skincare analysis
Mm,
because what happened was years ago I went to Procter and Gamble and to I think Colgate, whoever it was at that time, to say, look, I've got this amazing system. Would you like to help develop it? And nobody had any interest in working with me at all. But what happened, and this was probably 20 years ago, instead of having one kind of act, they came out with the act Total Care. And
mhm,
at the same time, the Listerine folks, I forget who was actually made. I think it wasn't Colgate. It was, but I can't remember now. But they came out instead of with just Listerine, they came out with Listerine Total Care as a
mm,
consequence of my going to them with my complete mouth care system. And back to the skincare idea, what they actually have done is mix the toner with the moisturizer.
mm,
So instead of this idea of cleanse, tone, moisturize, they said
mhm,
nobody's going to use 3 mouth rinses one after the other. But we do know that the acidifying the fluoride is going to make it a bit more mineralizing. And
mhm.
they did studies to show that the ACT Total Care
That's the
is,
one
I
I
think,
used.
7 times more mineralizing than the original.
Mhm,
But think about this. If I told you to mix your toner in with your moisturizer, you now have thin moisturizer, right?
right, right.
That is somewhat acidified. If that makes your skin 7 times better, what do you think putting the toner on and then the moisturizer?
Yeah,
I've never had the power to do the studies, but I guarantee it's not just 7 times more effective, it's probably 50
yeah.
times more effective. You know what I
So
mean?
yeah, so potentially it wasn't like the end of the world, but it was
No.
more helpful. Mhm.
No, it's just that you're thinning your moisture. If you dilute your moisturizer, it's half as moisturizing. So,
Yeah, makes
yeah,
sense. So I
yeah.
guess to my the xylitol comment you mentioned, I'm also like a big proponent of xylitol. I think it's a miraculous sugar alcohol, derived from birchwood, and we even apparently secrete some naturally in our own bodies. But there's been like a recent scare and stir around xylitol studies revealing that long-term use of xylitol is bad and can cause cardiovascular issues in the long run. What are your thoughts on that? I know, me
I
too.
know. I
I already
know. I know.
I know the answer, I just want our viewers
Yes, it's
to
so disappointing because we have over 100 years of study. We have people in Finland who've understood these studies. They've used it in pregnancy and in young childhood care. They give it out in preschool. They actually hand out xylitol gum in preschool in these countries as the children arrive after lunch and before they go home. And in a place like Denmark, I mean, you can look this up. The countries with the top oral health in the world, they don't fluoridate their water supplies. They do not. They use xylitol in pregnancy and in early childhood. And they end up in Denmark, the average person has a quarter of a cavity per person for life. I mean,
it's
for life. That is because they adjust the microbiome using xylitol, which we haven't probably got time to get into right now, but that's what it does. It then populates itself in a child's mouth. As I
mhm,
mentioned earlier, 40% of the biofilm is formed in childhood. So 40% of every adult child, every adult microbiome is going to be populated with healthy bacteria if we adopted this in America. And
yeah,
so by in 4 years from now, if everybody in the country did this, we would be on track for a similar outcome. I mean, they've been doing this for 70 years in many countries, Denmark, Finland, Switzerland, Japan even, and people have this much better outcome. Now, nobody knew what xylitol was when I started teaching about xylitol. And over the years, we've got lots of studies that are very exciting showing the benefits of xylitol. All I knew was that it had been used for decades, for 100 years in diabetic. I had a friend who was a nutritionalist, actually cooked with it. I mean, it's been used for diabetics. It has
yeah,
such positive feedback. And then all of a sudden, I get an alert that there is a study saying xylitol causes heart attacks,
yeah,
and it's on every media outlet. So I looked at this straight away. Well, first of all, you had to pay to get the study. It was a $45 paywall. I
right.
got the study, of course, because I've been promoting this for decades. I need to know
Need to get my hands on this, so what's going
what do
on?
they do here? And what they did was they took 10 people who were very old, very sick. Half of them were in heart failure. They were diabetic, taking medications.
Yeah,
Nobody had reported the status of their periodontal health or if they even had teeth. I have no idea. We
and I
don't
believe they never even, reported their xylitol intake, right? They
Well,
were
and
just
they were fasted, which isn't how we recommend xylitol for oral health. We recommend it after eating. They had put these people on a 16-hour fast and
mhm,
gave them the equivalent of 60 mints, but in a little drink that
yeah,
they chugged.
yeah,
So, what you have to know about xylitol is that our body, that you're 100% correct, it makes about 15 grams of xylitol daily, not all in one go, very spaced out throughout the day, because xylitol helps us to actually keep our glucose levels in
mhm,
check.
yeah,
It doesn't accumulate, it's excreted really quickly. In the gut, xylitol actually feeds, it's seen as fiber. Um, so if you don't digest fiber very well, this is when you get slightly upset by xylitol. That's when people say they feel gassy or bloating. It's because they don't have the digestive bacteria to digest fiber. And let's come back to that in a second.
yeah,
But normal people who eat raspberries and strawberries and carrots
yeah,
and apples and things will find this is perfectly fine in this small amount, like 1 to 2 grams at the end of a meal, because it will just go down with your food and it forms butyrate, which is a short chain fatty acid that is actually protective of our gut lining. So butyrate's very healthy, very good for health, and that's how xylitol is digested and excreted.
mhm,
So it's a very positive story all through from the minute it gets into the mouth where it feeds the good bacteria in the mouth. It makes plaque bacteria slippery. It
yeah,
doesn't kill them. It actually simply feeds them, but they can't process it
so they
because it is a different shaped molecule from sugar and from every other sugar alcohol. It's
mhm,
the only one that's a 5 carbon sugar, and it just doesn't fit their mechanics.
Yeah.
and that's why plaque cannot make the sticky stuff that sticks it to teeth, and when it can't stick to teeth, it can't form plaque, so
Right.
it's a brilliant
Yeah, I love it.
adjunct. I love
Yeah.
it too,
Yeah,
and
when I try to incorporate it on a daily basis, I can, like, really tell my teeth are just squeaky clean and yeah, all good things. But that study, what was interesting to me too is, like, they take, yeah, like you said, really unhealthy people, and then they douse them with xylitol and then show, like, oh, high levels of xylitol in their blood and high cardiovascular risk, and now we know xylitol is bad for you, and it's like,
well,
wait a minute.
that was the media, they didn't
Yeah, they didn't,
I
exactly, yeah, you're
read
right.
I actually read the report from the doctor at Cleveland who was a
Mhm,
primary researcher on this study. Now, what people need to know is it was funded. I couldn't get my xylitol studies funded because I really wanted to save the world and make xylitol show how xylitol can stop unnecessary dental treatments, and nobody wanted to do that. I mean,
yeah,
I spent years trying to do those studies. I realize now nobody wants to do a study that doesn't make them money.
right,
And, you know, nobody I couldn't find the person who could make money from us eliminating dental disease in America. But
right.
this study was funded by a private equity group that is interested in making an artificial pharmaceutical product that would replace xylitol. And you have to understand that. Why
Yeah,
why did they have the power to go to every media outlet with
yeah.
this and then it was so misreported. Nobody had a heart attack. There wasn't a single person who passed out on the floor of the clinic.
Right.
All they did was take blood and see that there was an increase in metabolites.
Mhm,
And that's where my experience was at an end. I like, was this really bad? I took the study to, there are a couple of scientists out there. I actually went to a preventive cardiologist to ask her, and
mhm,
we did a rebuttal to this.
yeah,
I went to the people who did xylitol studies in the 2000s. There, Peter Milgram, who's at the University of Washington. There's a Dr. Valentine at the University of Washington. They actually wrote to the people who published that article, that
mhm,
study, and said, this is a very badly designed study. I mean,
yeah.
I don't know about the science well enough. I'm not a scientist. I just
Well,
know
even in the end, they concluded that these results show that it's possible that xylitol may lead to
but
cardiovascular
that's
issues.
not even the case. It's not even the case. And it's not, they could have been wearing brown shoes that day. And they could have said, well, wearing brown shoes could cause
Exactly.
heart
Yeah,
attack. I
that's
mean,
what I how I read it too.
there are so many things. If you'd had a cigarette, you would have increased the metabolites by 1 to 200%. The metabolites that they were reporting were so bad, and they didn't report it as percentages, but a, a cigarette would cause a 100 or more percent increase. The increase with xylitol was 6%. I mean, this is really mean, if you want to be mean. The other thing we actually went as far as to look at the study. Before you do a study, you have to put in for approval.
Mhm,
When they put in for approval for the study, they actually were going to do a study not with 30 grams only, but with
mhm,
5 grams, which is a more realistic amount. I mean,
yeah,
I recommend 5 grams a day.
mhm,
Now, I recommend you divide it up into sort of smaller 3 to 5 times a day. You
yeah,
have smaller amounts. But they were going to do a drink, not just 30 grams, but a 5-gram drink, which would have been quite interesting.
to
And
see,
they asked to do that in the study, but the results were never reported,
mm,
which
so
is
they have it.
either they didn't do it, or when they did it, nothing happened.
Yeah,
So,
yeah,
unless you're a scientist, but the scientists I know were very upset. And
yeah, I
they
probably
they don't sell product. They're scientists who've worked with xylitol in the xylitol world at the University of Washington, seeing the benefits for pregnant women, for
yeah,
young children. They're about it for the right reasons. If you don't think I am,
yeah,
there really are people who are grossly offended by the study, and
Yeah,
it's
I
the
think
only one that's negative.
ultimately the problem with these kind of studies is first of all, the studies are kind of vague, right? But then media just completely skews it. What comes to mind is the study um, uh, periodontal disease, and there was a scare about flossing and how like you absolutely should avoid it. Which I know you're not a huge proponent of flossing, but as a hygienist for me at the time, everyone in the dental field was freaking out, like, oh my gosh, everyone thinks they absolutely have to avoid flossing because it's just gonna kill their teeth or whatever. But then if you look into the studies, they were doing it on severely periodontally involved patients with like a lot of bone loss where flossing was literally not going to help them, so again, it's just how the studies are presented and then how the media takes it and skews it, and then
Well,
people
and who did the study and why did they do it and who did they pick? I mean, these people picked, they wanted to show it caused heart attacks. So they go to the Cleveland Clinic and select the sickest people in the waiting room. I mean,
yeah.
there was another study done with Listerine where they actually, you know, the scare was that Listerine causes colon cancer. Well, they went to a STD clinic and took a similarly very tiny group of uh, homosexual gentleman and connected without really connecting the use of Listerine with colon cancer, which was, again, one of those sort of stupid studies that doesn't mean a thing, but gets everybody worked up and scared.
Right, right.
And I mean, every time you see this, you see how selectively the group is chosen. When
Yeah,
they showed that electric toothbrushes um, are helpful, they chose people with gingivitis and
yeah.
lazy toothbrushes. Well, if I've got a lazy toothbrusher, I'm going to give them an electric toothbrush. But if I've got a motivated brusher
Mhm.
and I can show them how to use a better manual brush,
Amen.
I am going to get a better result with a manual brush and a motivated toothbrusher than I will with an electric toothbrush that they're just poking around their
Yeah,
mouth.
that's very
It's
interesting that you say that because that's one of the biggest things that I tell people when they ask me, like, which one is better, manual or electric? I'm like, honestly, first of all, let's back it up, right? Let's talk about the user because you could do a better job with a manual than with an electric if you know what you're doing, right? And so,
absolutely. And it comes down in the end to empowerment and I think we have to professionals like you and I've met other dentists now and they're wonderful people. We need to form some kind of alliance where the public can trust us.
yeah,
You know,
yes.
we're not just spouting things that make us money or degrade something we think we don't like because it's in opposition to us.
That is my goal with when I started my channel was like I just want to seek truth and honestly present information to people so that they are empowered, like you said, to know what's better for their teeth. And speaking of which, one of the speaking of studies and speaking of empowering people, I hydroxyapatite. I don't even know how to
Yes, it's a word. Yes, yes.
Word. And I've been going down a rabbit hole with hydroxyapatite. I've been using hydroxyapatite toothpaste for a while. I have been thinking, it's an amazing ingredient. I've made several videos about it. I hear all these good things, and I've read a lot of studies, both beneficial and the dangers of it, and how different studies are misconstrued and all of that. But I would love to hear your opinion on hydroxyapatite. Should I be taking down all my
No,
hydroxyapatite?
I think the thing is though, everybody's searching. Most of the dentists I know who are in this world, in this sort of field of influencing,
Mm,
are trying to produce their own. At least that's what I've seen. Their own product, and they're looking to find something that's going to mineralize teeth, right? Because people don't want to have cavities, so they'd like to have them repaired. And nanohydroxyapatite has come along, okay,
mhm.
recently, but it isn't a recent product.
Yeah.
You know the story of hydroxyapatite, that it was NASA that needed something. And it's so funny because I knew that those astronauts were going to have dental problems because harmful bacteria grow in anaerobic conditions, lack of oxygen. Where are
Yeah.
these astronauts going? Into a sort of low oxygen environment. So it seemed to me that there was a good risk for them. And I tried to get in touch with NASA whenever that was in the 70s.
Yeah.
And instead they noticed that there were problems with the astronauts' health and particularly with enamel, and they were trouble cleaning their teeth. Well, hydroxyapatite at that point was a cheap product used because it has this magnetic affinity for fluoride. They were using it to take fluoride, excess fluoride out of water as a filter kind of system. And it was also used on land because fluoride occurs in the soil of many, many places. In India, for example, there's a lot of fluoride in the soil.
And I just want to butt in real quick. Hydroxyapatite is essentially calcium and phosphate ions together in a lattice,
Right,
right?
in a product, and it was used because that combination has this affinity for fluoride. So
Mhm.
remember that in the back of your head. And so they used it for the astronauts, and then nothing happened. We never heard any more about it.
Mhm.
And in Europe, several people had tried to get it through the European Safety Commission
Mhm.
and had failed. And the European Safety Commission, I mean, I don't know who they're made up of, but they were adamant for about 12 years that they would not approve this because they were nervous about the buildup of calcifications in the arteries.
Mhm.
Now, I don't know. I'm not privy to how they were. What was that about? I just know that one of the interesting things when I was part of AOSH, we did a test where we looked at calcification in the carotid arteries of
Mhm.
all these dentists and doctors,
Mhm.
preventive cardiologists, dentists, private physicians. The young people, how even 35-year-olds had some of them 50% blockage in their carotid arteries.
Mhm.
Now, I
Because of
don't is that
hydroxyapatite
is that
use or
normal? I don't know. I mean, I don't know why did they have calcification? Why did they have arterial blockage? They had poor oral health as well. We measured their periodontal pathogens.
dentists and dental professionals?
Yes, hygienists, dentists, preventive cardiologists, all these people
Before
attending.
hydroxyapatite was already on the market
No,
or
not then, but I'm just saying what was stunning was how much blockage these young people had. I
okay.
was like, "Ha, ha, ha," because I didn't have any, but what I'm just saying, and I'm not trying to it's not bragging, I'm just saying if we have a problem, how blocked are people's carotid arteries?
Mhm.
Separate entity. How
Right.
blocked are they? Are people having them scanned? Do we know if it's associated with poor oral health?
Mhm.
And if it is associated with poor oral health, which it to me appears to be,
Mhm.
then if hydroxyapatite being consumed in any way somehow calcifies that, that would be horrible. We
Right.
need more studies. I wouldn't recommend it because I'm not, and I wouldn't use it because I have enough hydroxyapatite in my saliva.
Yeah.
Why don't we just embrace that as if we can? I mean, if you've got somebody who doesn't care, who wants the quick fix, it's out there. You're not
Right.
responsible for them, but I don't feel like recommending it until I know I'm not causing a stroke.
Yeah. I mean,
You know?
I've used it on myself for at this point through different brands and stuff, probably for like 2 years, and I do understand the hesitation with the fact that it's there are plenty I feel like there are plenty of studies around it, but they are pretty fresh, they're pretty new, so I do recognize that, in 10, 15 years, somebody might go back and say, "Wait a minute, this stuff is
Well,
horrible,
but
blah, blah, blah."
that would be pretty serious stuff. Have you ever had a carotid artery scan?
No, I can feel my blood pulsing, so I feel like they're pretty clear.
You don't know until you know. And I think that it is something that ought to be done at dental examination visits. I think it should be in my book. I write that I think it should be a part of our evaluation of our patients.
And saliva DNA tests, right? That would be
Absolutely. All of this. There's a much bigger picture. I'm not saying don't go to the dentist. Now, my book says kiss your dentist goodbye. because I was trying to attract the attention of people who would listen to this.
Well, that's what people want to. I would love to for people and myself even to avoid going to the dentist, to get dental work for.
But you need an oral evaluation. You need oral health evaluation, and that needs to be done bigger and more expensive evaluation than we just digging around with a probe,
Yeah,
you know?
comprehensive. Yeah.
And I feel that helping people with their oral health is a really serious thing. I feel very confident with my system
Mhm.
because of my mother living 50 years. Now, she was also pretty healthy. She didn't,
Yeah.
you know, I also now have used this for 45 years. My kids have used it.
Mhm.
My grandkids have got to be teenagers with no cavities or anything at all. I mean, I have my own family doing it. I have a 50 plus year history of recommending it. I have the first 10 years of using it was in my patients where I was
Mhm.
seeing the results.
Do you think it's possible that if somebody were not to use your system, but incorporate, say, like, just xylitol and have a let's just say theoretically, ideally have a good oral microbiome to begin with and incorporated xylitol, do you think that would get them a pretty long way in terms of, like, good oral health?
Yeah, I think your
Right.
habits are key. The first thing is that you don't damage your mouth
Yeah.
with the use of things because you do have to do something before you go to bed at night that's going to
Yeah.
protect your teeth. And just brushing with xylitol might be adequate. Just putting some
Like,
xylitol.
I have 2 kids under 5, and sometimes my night home care routine ends up being just popping a couple of
Yeah,
xylitol because I'm like,
absolutely.
"It's too."
Grandma's Ellie does the same thing when they come over to my house and they've forgotten everything. It's like, who cares?
Yeah,
Have
and
a
for my son
xylitol
too, I'm
mints.
like, "Oh, I cannot brush his teeth right now. Just eat this xylitol mint." He loves your cherry berry flavor.
Sure. And this is the reality. And little kids should not be strapped down and screaming to clean their teeth. I
Yeah,
say give little kids the electric toothbrushes, the fuzzy brush or whatever it's called. I used to dance while my grandkids were brushing and it played a tune and you make it so much fun
yeah.
that they feel rewarded. And then you give them the 2 mints as a reward, as a fun thing when they're having story time.
Yep.
They get to enjoy and embrace the idea of oral health. And I think teenagers that are not wanting to brush their teeth, I would get mine to just at least rinse with the act because that will help them. Even
Something.
if you have plaque and you rinse with the dilute sodium fluoride, they won't get caries. They won't damage their teeth beyond belief if they are rinsing with that. I mean, I worked with drug addicts, with smokers, with people who couldn't care less about their oral health, and I was still able, with xylitol and some sodium fluoride products, if they'll
Mhm.
brush their teeth, if they won't brush their teeth, just rinse with the act. I mean,
So you
that's minimal
yeah, you
and
mentioned
it will
go
work.
ahead.
No, I'm just saying it
It'll work.
made a
It
huge
minimal and
difference.
it'll work, yeah, yeah. It's important to at least incorporate something. I feel like if there's one thing that people hear in this interview, it's like, "Just start incorporating xylitol," right? It'll get
Yes.
you a long way.
It's delicious. It can be used. The military used it. Actually, about when the Gulf War, they were aware that now the military the people were drinking more fizzy drinks, sodas and colas and whatnot in the battlefields.
Yeah,
And in places like Afghanistan and Iraq, they weren't able to have the water and the
yeah.
supplies to actually clean their teeth always. So they incorporated 2 pieces of xylitol gum in
Mhm.
every meal pack
Yeah,
for the military. Every MRE had 2 pieces of xylitol gum. It was
yeah.
a program called Look for Xylitol First.
Hmm.
And they did that to keep the troops' teeth healthier during
That's crazy.
these.
They recognized even then how important it is to keep a healthy mouth because what people don't realize is, like, your teeth are so important. Well, I mean, even with your mom's story, right? Like, as soon as you get rid of your teeth, you start introducing so many problems to the
Well,
health.
unless you do dentures, I mean, I think the problems are for people who have implants and these full mouth rehab on implants. They've got to look at the whole picture pretty deeply to know what's going on. My father, just to fill in the story of my family, don't think I came from a family of people with pristine teeth. My father had all his teeth taken out at 35, entering the UK
Mm.
British military in the war, and they just took all his teeth out and gave him dentures. And the interesting thing, he didn't have dementia, so I don't know if it's women and not necessarily men.
Mhm.
And these are the things we don't know about.
Many studies that we need to do and get down to. But the other thing I wanted to mention, you've talked about so we kind of discussed, hydroxyapatite, your stance on it. I'm still kind of leaning more towards, because it's technically calcium and phosphate. Our teeth are made of hydroxyapatite, but I understand the reservations. But then you also mentioned fluoride too. And I've personally, doing my own research and stuff, I'm starting to get I have reservations about fluoride in terms of it being a neurotoxin and that we have it in our water supply and we already get so much of it. I don't personally use fluoridated dental products. What is your take on fluoride?
Well, the first thing is, if you look back at the story of fluoride, how
Yeah,
it was found, it was in the 1900s, late 1800s, early 1900s. A dentist in Colorado, actually in Colorado Springs, noticed that all the patients in his office had brown stained teeth. That's how the whole fluoride story begins, right
right.
there in Colorado Springs. And basically, long story short, he called in, he went all over the world finding other people who had brown stains. And they were in India, they were all over the world because naturally occurring fluoride, when consumed under the age of 6, will have the potential, naturally occurring. All right, this is just out of the soil. This is how they discovered it in 1900s, not artificially put in. It was just there. And they found that the more fluoride in the water, the more staining and pitting and
Right.
damage to the baby, to the adult teeth. Now what actually happens, we then know, is that baby teeth grow in uterus. When the baby's in the womb, the baby teeth form. Adult teeth start forming from birth. The day the baby is born starts the first little cell called an ameloblast
Mhm.
squirting out enamel and forming the permanent teeth. And so permanent teeth start forming between birth and 6 years old. So during those years, if there is fluoride consumed, in any it's really quite a small quantity that they found because the government did this study back then in the 1900s, and even 1 part per million was causing an effect
Hmm.
in the construction of the teeth between birth and 6 years old.
Mm.
So have always known what they decided. The government decided that the cosmetic effect was minimal at 1 part per million. So
Mm.
they felt the other thing they noticed about these teeth that were mottled and brown and stained and damaged was they were very resistant to decay.
Right.
So
They
that's
found
when,
that medium and that balance of
well, they there was this twist in the story because originally it was all about taking fluoride out of the drinking water.
right.
Then in 19, I think it was 21 or 25, the Aluminum Company of America,
Mhm.
they discovered this brown staining in the population living around Alcoa, this company that manufactures aluminum. And they found out that actually this company was dumping the waste product of aluminum manufacture into the water supplies. And it was at 15 parts per million.
Of
Well, we know
fluoride.
one part per million is extremely damaging. 15 parts per million was a huge problem.
Yeah.
At that same moment, everybody who was involved in that fracas that occurred, it seemed like they were all part of the Carnegie Mellon Institute in Pittsburgh, and they started working with the government. And then all of a sudden, they came up with this idea of fluoridating our water supplies.
Mhm.
So there's a very funky story to the
Mm.
fluoridation of water supplies.
Sure.
I don't think we should be drinking fluoride
Mhm.
at all. I mean, limited. It's going to be, you're always going to drink some. If you drink tea, tea has about 3 parts per million.
Because most tea, right, is harvested, I don't know how you say it, in India, right? And India is
India and
naturally
China and Japan, where there's fluoride in the soil.
a lot of fluoride in the soil. Yeah.
And well, it's not so much have a lot, it's just that the fluoride tree actually, condenses it into the leaves.
Mhm.
And a little bit of fluoride for your skeleton will keep your body strong. I mean, it's not that that's bad. It's just how much. If you drink tea all day long, and
Mhm.
one of the concerns is instant tea, like powdered iced tea,
They drinking the powdered
because
the
they
powdered
condense, they brew the tea really strong before they then powder it, and then you mix it up with fluoridated water. You can have up to 13, like the around the Aluminum Company of America, in iced tea.
Mhm. Yeah.
Be aware that when you're drinking, but it's also in ground beef because fluoride gets into bones.
Right.
And when they grind beef, even grass-fed beef, and maybe even more so with grass-fed
Going
beef,
in there.
there can be fluoride in the meat. It's in potatoes. I mean, it's everywhere. So
Have you heard about it being like a neurotoxin and recently
yeah,
studies
in
it
China,
like
in China, there's a lot. They have a lot of factories that create the same toxicity as Alcoa did in America, and they're suffering with 13 to 15 parts per million, and they're finding that that can be a neurotoxin. I wouldn't drink. Yeah, I don't think we should be drinking and ingesting 15 parts per million.
yeah.
But I also feel that children should not be consuming fluoride, and it's in baby formula. And be
Yeah.
aware, I mean, be an aware mother that you don't want your child to be drinking iced tea.
Yeah.
Um, and maybe we don't know what it's in. We need more information for mothers to know,
Yeah.
because you don't want to be giving your kid a huge amount of fluoride. As an adult, is it damaging your brain or your teeth? Or
Pineal gland or something like that, they
I don't believe that unless it's at these really high levels. And we've known about that because a lot of people in India had fluorosis. They had fluorosis as children, and then they had they had such sort of hardened bones that they had spinal problems from that. So
yeah.
consuming vast amounts of fluoride is one thing.
In
Topically applying it to stop you from needing a filling, I choose to topically apply fluoride and spit it out because I don't want the plastic filling in my mouth or the sealant or, any of that stuff going on.
speaking speaking of plastic, I think you remember that you discovered, I feel like, that I wear plastic retainers for ortho, and we just, like, dove into all of that with, orthodontics and shifting your teeth and all of that. What is your take on orthodontics, on wearing
Oh,
plastic?
it's exhausting, isn't it? I mean, this is the whole thing. I actually, the Dawson Academy is a group of dentists who study occlusion.
Mhm,
I'm on the borderline of signing up for their programs because I want to know the latest in occlusion.
mhm,
I don't think, on the other hand, that I need to. I think what we all need to do is realize that moving teeth around, it's kind of like suggesting a product to a patient. If you suggest hydroxyapatite to your patients,
mhm.
take yourself fast forward in 30 years. Are you going to be okay with finding out it wasn't so healthy? We've all got to take that responsibility as teachers.
And that
We,
risk.
we've got to know what we're teaching people. And I would say to people, be very cautious of Invisalign and moving your teeth and orthodontics. Don't just go to some online person.
Definitely, please,
Get a
please stay
couple of
away.
Yeah, get a couple of opinions from not young people who've just come out of dental school, but from experienced orthodontists, maybe a prosthodontist or a Dawson Academy trained dentist who studied occlusion.
All right, guys, so our time got cut short, unfortunately. I do still have a few more questions for Dr. Ellie, and perhaps this would be an opportunity for you guys to comment below with your questions. We'd actually love to do a part 2 together.